Today I want to speak with you about some developments that will impact the community, impact you, and impact the men and women in the Sheriff's Department. It's no surprise to you that the economy is in pretty bad shape. I hope that we'll see some improvement in the next 2 years. But in the meantime, cuts in federal and state and local programs are creating some real problems for us. A very critical problem is the proposal for deep cuts in the state mental health care delivery system. As I speak to you today, there are plans for whole wards of Western State Hospital to be closed. These plans will remove people from the secure hospital wards and put them into less secure community facilities. Among the wards targeted for closure are those which house dementia and Alzheimer's patients. Other releases may include those who suffer from other chronic traditional forms of mental illness. Most of these patients are in Western State Hospital because they have no place to go in the community. Sometimes their families are not able to be their caregivers. Sometimes they have no families. Many of them cannot care for themselves, or they cannot cope, or they cannot control themselves. You may be asking what this has to do with law enforcement. The answer is sad but simple. When we release seriously mentally ill people into the community care, they do not always remain in care facilities. Too often, the community care facilities are not equipped to look after the most serious cases. Too often, these people end up on our streets. And when they're not in secure facilities, they're more likely to have contacts with law enforcement. Now, I am not saying that all of these people are violent and dangerous. That's simply not the case. But all of these people have difficulty coping and caring for themselves. That's why they're hospitalized. A few people with mental health issues may become violent or dangerous. Just today, we had an armed, barricaded hostage situation with a man who was disturbed, and I'm pleased to say it ended with no one hurt. So some people do act violently, but many others are more likely to present disruptive public order problems. And when this happens, communities will want someone to intervene. It will result in calls to 911, and that will result in a response by a sheriff's deputy or a police officer. Sometimes results in arrest and putting the person into jail. Now, you know and I know that most of these people do not belong in our jails. A much better approach is a mental health facility. The problem is that mental hospital wards are closing. There are fewer mental health beds in Pierce County than there were 2 years ago. So the state's efforts to deal with this very real budget problems by closing beds and cutting back on staff results in more cost to Pierce County taxpayers. It means that we'll need to fund police response and court costs and costs of housing the mentally ill in our jail. There are direct costs involved with this, but there are opportunity costs since such activity may take away from other responses, to other calls. We may reduce the cost at the state level, but increase the cost at the local level. We've already seen an increase in the number of mentally ill inmates in our jail as state cuts slow down the pace of competency evaluations for those arrested for criminal conduct. Again, we should ask whether it really saves money to transfer the control and care of the mentally ill people from a psychiatric facility to law enforcement and jails. Shifting the cost burden to our local community is unfair to Pierce County taxpayers. Having to deal with increasing numbers of mentally ill people in the field and in the jail is unfair to my staff. And being shuttled between the mental health care system and the criminal justice system is unfair to those who suffer from mental illness. I've made my objections known to the governor, the state and local legislators, and others about this policy. I know state government is faced with financial problems. I just want to see that the response to this real problem at the state level does not turn into some very real public safety problems and financial problems at the local level. So I encourage the state to look to one of its prime legally mandated responsibilities, the care of the mentally ill. In the meantime, my staff and I will work with communities and with state agencies and with private mental health providers. We want to address the issues before they turn into problems. We want to see that the problem is not simply taken off the state's front porch and placed on the county's front porch. And while all of this is going on, we need to see that people who truly need mental health care are not the ones caught in the middle. It's an issue which concerns all of us. Thank you.